General Practitioner and Clinical Director at Chapeltown Primary Care Network in Leeds, Dr. Abiye Hector-Goma, joins me from the United Kingdom via Zoom. Good to have you join us, Dr. Goma. We see that there are cases soaring in places like India. We're still seeing cases in places like France, in UK. And now there is this move to hot deliveries, or there is this shortage of deliveries of vaccines to the EU. How does this play out for EU in terms of trying to curb is number of COVID-19 cases?
Well, in terms of the United Kingdom, there has been a fairly steady supply of vaccines. And so far, over 31 million vaccines have been delivered to more than 55% of the population. So far, I think the United Kingdom is doing quite well. But there have been issues about supply of vaccines to the EU. While we have done 55% of the population, I think in the EU is about 18% of the population. And that's where there's been a bit of consternation, because there's a feeling that enough vaccines haven't been supplied. But that's also interesting because there has also been a reluctance. Only about 44% of vaccines delivered to the Netherlands have been utilized, the AZ vaccines, and then about 50-something% in France. So while there's concern that the vaccines have not been delivered according to expectation, but even the ones that have been delivered, there's been a reduction in public confidence out there in the use of the vaccine.
What about those who have taken the first dose of the vaccine? We know that the EU is also relying on the Moderna vaccine, as well as the Pfizer-BioNTech vaccine. But for those that have taken the first dose of the COVID-19 AstraZeneca vaccine, what then happens with this latest development?
I'm aware that, it's quite a fluid situation where a lot of studies are being done as the vaccines are being delivered. And I know even in the UK, some research is going on concerning mixing of vaccines. But so far, there is no direction about that. So people are expected to take the same vaccine as they had previously. There's no guidance on that. So that's how things are. But I guess that the time would come where, for example, if somebody took a first vaccine and had some side effects, would they now not take a second dose of any vaccine, or will it be possible for them to have a second dose of a compatible vaccine? And I think somewhere along the line that would happen.
But for those that have taken the AstraZeneca vaccine, and with this latest development, if there is no provision, for example, for a second dose of that vaccine, especially now with this bickering or controversy between AstraZeneca and the EU, isn't that a challenge already for that person?
Well, the AstraZeneca controversy, for the majority of us, we think is more of a storm in the teacup, because there are about 4.9 cases per 1 million vaccines delivered. And that is so negligible. For the individual that is affected, yes, it is important. But from a population point of view, it's actually quite negligible. So there are very few people, when you look at the millions of vaccines delivered, who cannot have their second dose. So generally, it's suggested here that people who are under 30 years old shouldn't be commenced on the AstraZeneca vaccine, because the benefits may not outweigh the risks. But apart from that, the delivery of the vaccine is going on steadily in the country.
AstraZeneca responded to the EU saying it takes a while to replicate a vaccine. It is not something, it's not a plug and play system. It also accounts for the global shortage that was seen in some places. Some countries have done so well. But we've also seen some countries in the EU, for example, France and Italy, ease restrictions in the past few days. Does that mean that if there is a shortage, as we're seeing now, that they might have to go back to maybe a lockdown or just some sort of restriction?
Definitely there is no alternative that would have to go back to doing the basic things about social distancing, staying indoors if you don't have to go out. Look at what has happened in India now. It's beyond heartbreaking. As at a month ago, there are about 75,000 cases, and now it's about 350,000 cases daily, and about 200 deaths a day, now about 2,500 deaths a day. And that's because people just let their guard down. They were out there going for religious festivals, having political rallies, and just couldn't be bothered. So really, the first thing is that a lot of people just need to know that your best bet really is social distancing and then minimizing contact with people, because you just don't know what will happen next. The case in India, the Brazilian case, even what's happening in Europe just tells us that if you let your guard down, it's just going to be disastrous.
Do you also think that sometimes some of these countries set very unrealistic targets? For example, the EU has said that it wants to vaccinate 80% or 70% of its population, at least with one dose, by this summer. And if that's, when that happens, sometimes you see that people start to have a false sense of security because of this kind of targets. Do you think that are unrealistic, that people should just stay with restrictions until vaccination is actually done?
Well, I guess it's when you look at it from a human point of view, when people are used to enjoying their freedom, they don't have draconian regimes, breathing on their backs and all that. They like their freedom. So people have been kept indoors for well over a year. So every opportunity they have, they want to be able to come out and celebrate and do things. But everything we do make choices that have effects. So really, yes, the governments have targets, and like AZ has said, and every other, even Pfizer and all of that, you can have your best intentions. And look at what's happening in India. India is supposed to produce a lot of vaccines for the global initiative for low and middle income countries. And with the current disaster going on in India, I would struggle, if I'm the leader of that country, to get vaccines being produced in my country to go out when my people are dying in their thousands. So you can have great plans, but of course, there will be obstacles in the way. And it's about how people can come together to try and overcome the obstacles that face them currently.
What you just said about India, saying that, look, if I'm the leader of that country, I would struggle to say I'm producing these vaccines in my country. I want to ship it to another country that doesn't have as much cases as I do. Doesn't that play into the issues around vaccine nationalism being stated by the World Health Organization?
I mean, when you look at it, the whole purpose of a vaccine is to make it available to those who are at greatest risk. And that's why when you look at even the rollout of the COVID-19 vaccines here, everywhere else, you start from the most vulnerable and then you work your way down. I mean, the UK, we're just getting down to those who are age 42 and under. So if you now have a situation where entire cities are almost being overwhelmed, hospitals, people are dying on the streets and all of that. And when you compare with other countries where there are very few cases, I mean, this is the eye of the storm is in India, Brazil, and all that. So I think the need is greatest there. While you want to do some, proportionate distribution, you really want to put the vaccines where the need is greatest. So of course, India has a commitment to produce 1 billion vaccines for the world. They need about 300 million vaccines for the high risk Indians. So it's kind of a difficult situation for them. They will need to do their best to support the world, but they have a nightmare situation on their hands.
Absolutely. Quite alarming situation there in India. General practitioner, clinical director, Chapeltown Primary Care Network in Leeds, Dr. Abiye Hector-Goma. Thanks for talking to us.
Thank you very much.